Cochlear hypoplasia represents a group of cochlear malformation in which the dimensions are less than those of normal cochlea with internal architecture deformities. In cochlear hypoplasia, there is clear differentiation between the cochlea and vestibule, and both of these structures occupy their location relative to internal auditory canal. In this regard, they are different than the rudimentary otocyst and common cavity. In smaller cochlea, it's usually difficult to count the number of turns with the CT or MRI. But you can say if cochlea having less than 1.5 turns, it is called hypoplastic cochlea. According to radiology and histopathology, there are four types of cochlear hypoplasia. Type 1 is bird-like cochlea. The cochlea is like a small bird, round or ovoid in shape, arising from internal auditory canal. Internal architecture is severely deformed. There is no modulus or enteromuscular septa can be identified. In type 2, this is cystic hypoplastic cochlea. The cochlea is smaller in dimension. There is no modulus or enteromuscular septa, but its external architecture is normal. There is wide connection with the internal auditory canal. The vestibular aqueduct may be enlarged and the vestibule may be dilated. In this type, hypoplasia, gusher, or unintentional entry of the cochlear electrode into the IAC is possible. Type 3 cochlea with less than 2 tons. The cochlea has a short modulus and the overall length of the enteromuscular septa is reduced, resulting in fewer tons less than 2 tons. The internal modulus or enteromuscular septa or external architecture are similar to that of the normal cochlea, but the dimensions are smaller and number of tons are fewer. The vestibule and semicircular canal may be hypoplastic and cochlear aqueduct may be hypoplastic or aplastic. Type 4 cochlea with hypoplastic middle or apical turns. The cochlea has basal turn which is nearly normal and middle and apical turn are severely hypoplastic and located anteriorly and medially rather than their normal central position. The labyrinthine segment of facial nerve may be located anterior to the cochlea rather than its usual location. This is CT scan of type 1 cochlear hypoplasia showing bird-like cochlea. There is no internal architecture is identified, like there is no modulus or there is no enteromuscular septa can be seen. This is type 2 hypoplastic cochlea showing small size with there no modulus or enteromuscular septa is there. Vestibule may be enlarged in this case, and this external architecture is almost normal, but there is no modulus or enteromuscular septa. You can see this CT scan. But you can see in cases like vestibular dilatation also. This is type 3 cochlear hypoplasia showing less than 2 tons. It says short modulus with shortened enteromuscular septa. The internal and external architecture is similar to normal cochlea. In some cases of type 3, there is cochlear aperture is also aplastic, as you can see in this black arrow, with some having hypoplastic or aplastic vestibule and semicircular canals. In type 4 cochlear hypoplasia, it is having normal basal turn, but there is hypoplastic middle and apical turn is there. So it's normal cochlea, but there is difference in the middle and apical turn which are hypoplastic. As the cochlea is smaller than normal, the length and cross-sectional area of the cochlear duct are smaller compared to normal cochlea. In these type of cochlear hypoplasia, thinner and shorter electrodes should be used. A standard electrode may be too large for the cochlea. It may not be possible to obtain its full insertion. Hypoplasia type 2 has the possibility of CSF leakage. A short electrode with stopper type silicone ring may be used with the type 2 hypoplasia.